Welcome back to WKYT News here at 6:30 on the CW Lexington. One hurdle down, another to go. With a narrow victory in the House recently, they passed the American Health Care Act, a repeal to Obamacare.
But now this concern is whether the bill will be dead on arrival once it reaches the Senate. There's two options for the Senate. It could work with the version approved in the House or start from scratch with its own bill. But one thing is clear, Republicans need at least 50 of their 52 senators on board if their legislation is to pass. Despite that, President Trump remains hopeful.
And some critics of the health care plan say its proposed cuts to Medicaid funding go against the president's own words on the campaign trail.
Save Medicare, Medicaid, and Social Security without cuts. Have to do it. Get rid of the fraud, get rid of the waste and abuse, but save it. People have been paying in for years, and now many of these candidates want to cut it.
President Trump has answered to those criticisms. He says the current Medicaid programs has problems, but that the new health care bill aims to fix them. To help us break down the news live here, Aaron Yelowitz joins us. He is a nationally known economist and professor of economics at the University of Kentucky. Welcome. He's been here several times before. Glad to have him again. There are many people out there, Aaron, who don't understand this bill. What exactly is the American Health Care Act about in terms of how it's going to affect overall insurance coverage here?
So a little bit of background. First off, between 2013 and 2015, 16 million people gained health insurance coverage. The gains for children and for the elderly were largely minimal. Essentially, all of the gains were for adults aged 18 to 64. In fact, a lot of the gains were for young adults, those aged 18 to 30, where about 5 million gained coverage. It's clear that if enacted, the new health care bill will reduce insurance coverage. The nonpartisan Congressional Budget Office forecasts that about 14 million people will lose coverage by 2018, so just a year from now. And that's mostly because of removal of the individual mandate. Importantly, a significant number of people who have employer plans and are mandated to purchase it will now drop out of that, in a sense meaning that they're not actually losing access, but simply deciding that it's not a good deal for them.
So with those losses in coverage, what do you expect to happen with health?
It's interesting. National surveys ask people things like their health habits. For example, do you smoke? Do you have substance abuse? Are you obese? And then also ask them to report whether their health is excellent, good, fair, or poor. I've looked at that data after the Affordable Care Act was rolled out with its large insurance gains. And essentially, we see no change in these health measures in 2014 or 2015 compared to earlier years. Put differently, the big gains in health insurance coverage did not translate into big gains in health. Given that many of the young adults were the ones who actually gained coverage, and they're generally in pretty good health to begin with, perhaps upon reflection, it's not too surprising that if we, say, pared back the health insurance, we wouldn't see many changes in their health either.
Makes sense.
How do you think this is going to affect people's pocketbooks if the Senate comes through with some kind of plan that is similar to what the House has passed?
There are two possible ways in which it could affect people's pocketbooks. First off, the AHCA, the new legislation, will change premiums. One of the key features under current law is that older individuals pay no more than 3 times as much as younger individuals in the health insurance marketplace. That would change to 5 times under the new law. What that basically translates into is lower premiums for young adults and higher premiums for older individuals. But then there's another thing. There's a convincing literature in economics that suggests that expanding health insurance improves financial security. The Affordable Care Act reduced the number of unpaid bills and debts sent out to third parties. The reason is because really expensive medical events are now covered for people who otherwise wouldn't have had insurance.
Well, that was a real breakdown, wasn't it?
Yeah, thank you very much.
Thank you.
And,
Thank you so much.
We'll see what the Senate does with this plan, whether or not it's the House version or something maybe a little bit different or a lot different.
Yes. So I suppose one takeaway in the entire public debate, it's kind of been focused a little bit on bean counting of asking how many people will gain or lose coverage. I think one of the important things to kind of take a step back and think about is, yes, we care about people having health insurance coverage, but why? The answers are usually because it matters for people's health or it matters for their financial security. The evidence seems to suggest that that health insurance, at least in kind of the very short run, doesn't have much effect on health, and it can matter for people's finances and security.
Okay, thanks, Aaron.
Aaron Yelowitz from the University of Kentucky.
Thanks so much.
And you can join the conversation by leaving your comments on WKYT.com or on our Facebook page. Let us know what you think about this very important issue.